Introduction on achalasia. General objective. The study is geared towards the enhancement of knowledge and basic nursing skills in giving care for patient affected with achalasia. Specific objective. To define terms associated with the etiology and the pathophysiology of achalasia. To identify the complications/S associated with achalasia, specifically aspiration pneumonia. To formulate an effective nursing care plan specific to a patient with achalasia. Overview of the disease. Achalasia. A disorder of the esophagus that prevents normal swallowing. The term achalasia means failure to relax. Common complications of achalasia. Gastroesophageal reflux disease, GERD, or heartburn. Barrett's esophagus or Barrett's mucosa. Achalasia patients have an increased risk of developing Barrett's esophagus or Barrett's mucosa, a pre-malignant condition which may lead to esophageal cancer over a period of years. Aspiration pneumonia. Food and liquid, including saliva, are retained in the esophagus and may be inhaled into the lungs, especially while sleeping in a horizontal position. Classification. Greater than esophageal diseases. Category 1. Primary, idiopathic. 2. Secondary. Destruction of myenteric plexus by tumor cells, i.e. metastasis or lymphoma or invading carcinoma from the gastric cardia or fundus. 3. Infectious, Chagas disease. Types. O. Primary achalasia I. The most common subtype and is associated with loss of ganglion cells in the esophageal myenteric plexus. Secondary achalasia is relatively uncommon. This condition exists when a process other than intrinsic disease of the esophageal myenteric plexus is the etiology. Examples of maladies causing secondary achalasia include certain malignancies, diabetes mellitus, and Chagas disease. Incidence. A. Lung Center of the Philippines, a rare disease and it is the first occurrence in LCP. B. Local, a rare disease and it not commonly monitored by DOH. C. International, U.S. Incidence of achalasia is 1 to 3 cases per 100,000 population per year. Familial clustering is observed, but a genetic relationship is not established. Nutcracker esophagus is the most common motility disorder, greater than 40% of all motility disorders diagnosed, but it is the most controversial in significance. Race. No racial predilection has been described for achalasia. Sex. Achalasia has no sex predilection. Age. The incidence of achalasia peaks in those aged 20 to 40 years. The disease has been diagnosed in infants and in patients well into their 80s. Mortality/morbidity. The primary morbidity associated with this effect is esophagitis, which is readily recognized on endoscopic examination. The mass of pooled secretions and solid materials places the patient at risk for aspiration. As many as 30% of patients with achalasia report nocturnal coughing episodes. Esophageal carcinoma and a greatly dilated esophagus are found more frequently in patients with long-standing disease than in patients with early-stage achalasia.